Thank you for joining me, Dr. Amir, here at Fortis Health for another insightful session on the topic of testosterone replacement therapy. When we look at testosterone replacement therapy, we're looking at progressive, positive outcomes. And obviously, there is some element of patience that one has to have when you start therapy. Remember, these doses are microdoses, small amounts on a regular basis, being monitored over time. What we don't want to see is that you get a sudden burst in all of these amazing outcomes, because we know that if something gives you a sudden burst, it can also give you a sudden decline. And we don't want that. We want you to benefit over the progressive outcomes with therapy. And there are a kind of a timeline-ish that you look at. So at 3 months, you're going to get a level of increased energy, increased emotional well-being. There will be some enhanced libido and a increased erectile function, or rather reduced erectile dysfunction. At about 6 months, you see increased strength, increased muscle mass, improved cognition, enhanced well-being in terms of energy levels, and decreased body fat. What we find is from 12 months onwards, up to 18 months, you get the benefits like increased bone mineral density, and also performance activities will be incrementally increased as well. So things like we mentioned muscle mass, fat loss, cognition, libido, and erection. So you're looking at about 3 to 4 months initially for some changes, and about 6 to 8 months, and then 12 to 16 months thereafter. Now you're saying, well, actually this is quite a lengthy process, but that's the point. We want you to take the journey positively. We want you to benefit throughout the process. And it's really important, especially as a TRT clinician, that you don't just take the treatment. You have a whole change. You change your dietary habits, you change your lifestyle, you change your sleep patterns to have a positive impact. You go to the gym and do regular weightlifting or resistance training or exercise or swimming or what have you. You can't, it's not like a chamber that you step into, close, open, and you become this miraculous Captain America, quote unquote, proverbial outcome. You need to do all of the things and activities that will augment, or rather be augmenting, whilst on TRT. I had a case many years ago of a patient on TRT who didn't do any changes. If anything, he said, okay, libido's great, but outside of that, there's nothing else. And I remember saying to him, that's a waste. You've actually fueled your supercar with the best fuel possible, and you've just left it in the driveway. That's a real waste. That's a real shame. And if anything, it's not a good use of testosterone, actually, in terms of replacing that. You don't reap the benefits of it, because by reaping the benefits, you can actually alter your other outcomes, your other comorbidities like diabetes, hypertension, obesity, chronic illnesses. There's been shown evidences that they can actually be reduced, if not negated. And I think it's unfair that when people go on therapy, they just think it's a magic bullet. If I take this, it's going to sort everything out. No, you have to do the principal things in and around your lifestyle, your slender habitus, your eating habits, your dietary, your thinking patterns, your sleep patterns. They all have to be positively curated and changed to get the best benefits from testosterone replacement therapy. I get this question quite a bit, and it is worrying, because not only is it worrying from the point of view of longevity, it's also worrying from a financial point of view, because obviously not many, if at all, any GPs actually prescribe testosterone replacement therapy. Even endocrinologists that I know of, unless they specialize, as I do specialize in endocrine from the specialist interest of endocrinology for testosterone replacement therapy, if they haven't got that background, they're going to be kind of not too keen on giving out testosterone because of all of these unfortunate associations with people who abuse testosterone, unfortunately. So yes, one does think longevity-wise, do I have to keep on taking this medication? On top of that, there's a financial burden I have to obviously partake in. The good news is testosterone is not a life hormone. You won't okay, what's the example of life hormone? Cortisol is a life hormone. If you don't have any cortisol, or you don't take enough cortisol, or you're deficient in cortisol, you can actually induce some very horrible outcomes, what's referred to as Addison's crisis, and that can lead to things like coma and stuff. So obviously, those are hormones there is no question about that, and definitely endocrinologists would never ever even think to ask you to go down the private pathway for that, which they shouldn't really. Another life form is insulin. Diabetics, right? Children who are born or have congenital diabetes or type 1 or insulin-dependent diabetes, or those who later on develop insulin-dependent diabetes, or those who are already diabetics on oral hypoglycemics who get converted to insulin-dependent diabetes. Can you imagine if someone swiped away your insulin? Or worse still, gave you too much insulin? So again, these are life hormones. To a lesser extent, thyroxine, which comes from the thyroid gland, regulated by the thyroid-stimulating hormones in the brain, if you haven't got enough of that, or God forbid you took too much of it, it can be quite problematic. Well, actually, too much of it can actually induce certain cardiac outcomes like arrhythmias and what have you. So the good news about testosterone is that if you come off it, you might feel a bit tired, lethargic, you might not have great libido, but you don't have to worry that you're going to have some disastrous outcomes. Yes, we know about the cardiovascular risk and the diabetic risk and all these things that can be mitigated through testosterone replacement therapy, but if we're talking about in the now, no. One can come off it slowly and carefully and guided off it, and then say, well, actually, I don't want to be on it anymore. Or rather, they come off it and they say, oh, been off it for a little while, I actually want to come back on it. But I tell patients, the amount of time we spend on things that have got absolute no benefit on us, on our internal systems, on our physiology, on our health, it's actually quite distressing. And if you take one thing from this whole FAQ session, is for crying out loud, take care of your health. And there is no cost, there is no time, there is no added burden of responsibility when it comes to your health. If tomorrow someone said to you, oh, you've got this outcome as a consequence of smoking, or your blood pressure is so high it's damaging your kidneys, or you've had a heart attack or stroke because you're a diabetic, you will take every step possible to reduce, negate, or mitigate that comorbidity because you don't want it to happen again. Likewise, you will need to be intelligent about your health. Remember, replacing testosterone or optimizing it if it's insufficient will not only benefit you in all the things we spoke about, your mindfulness, your energy, your libido, your muscle mass, your fat redistribution. It will also help with your performance as an individual in and around other people, your family members, your spouse, your partners, your children, your parents, your work environment. Your performance at work goes up. So now your productivity gets better. So I tell patients, look, it's not a lifelong hormone, you're not going to be stuck on it, but why would you not want to maintain a good testosterone level if it's giving you all these outcomes? And it's quite sad when people will spend a lot of money on things like eating out, drinking cups of coffee from Costa, what have you, but yet when it comes to managing their health, they're very flippant. And if there's one thing you have to protect and guard, and it's sacrosanct, it's your health. And I push that agenda quite hard with patients. And even if they don't come with me, that's fine. But wherever you go, make sure you maintain a good health at all times. From our clinic, when it comes to monitoring patients' progress in terms of outcomes, in terms of their physiological outcomes, in terms of their symptoms, in terms of their blood profiling, we look at them in that respect. So usually when you start therapy, you have comprehensive blood test, a consultation around those blood tests, and then basically we speak about the different types of therapy you can take on board depending on what you want in terms of outcomes. Then we recheck your blood between 2 to 3 months, and then 4 to 6 months thereafter, and then 6 monthly thereafter, or sooner, depending on how you feel. We look at things like your red cell count to see have you gone too high up with your hematocrit. We look at your kidney function, which sometimes patients can become, very rarely we see it, if ever, something known as focal segmental glomerulonephritis. That really ever happens, to be fair, but we keep an eye on one's kidney. Liver function test, we keep an eye on that as well, especially if you go on some oral preparations. Some patients go on something known as clomiphene, which is an off-license, off-label medication that you can use for fertility-sparing testosterone replacement therapy. We look at things like your vitamins and minerals to make sure that you're actually taking the vitamins when we suggest them to take those. And obviously we look at your hormone profile, so your estrogen, your testosterone, your free testosterone, your LH and FSH, which can either be suppressed or obviously accelerated based on what type of TRT therapy you're on. And then with that, we also look at your symptomology, your energy, your recovery, your muscle mass, your fat redistribution, libido, your erectile function. All these things taken into consideration in every single episode. And if you develop any local problems, so if you're injecting in your leg or injecting in your arm, you can get local inflammatory changes. Again, with us, we supervise you. We never let you do anything alone. We make sure that we're literally holding your hand for the most part of the journey until you tell us, let go of me, I'm good, I can carry on alone now. But we want to make sure that this is a one-to-one supervised therapy where you feel supported, safe, and encouraged and given as much care as possible, especially when it comes to hormone therapy. So yeah, we make sure that we manage you throughout every single step. And even between those stages, we make sure that you have good contact with us, either through email, through WhatsApp, or through phone calls. We are very much make you feel like you're the only patient we have. And that's how we react. And that's how we act in and around Fortis Health.